Diffuse thinning is a recognized form of male pattern baldness and is defined as widespread thinning across the top of the scalp. Let's say a diffuse thinner comes into our practice asking to restore his hair. The good news with diffuse thinners is they tend to get quite impressive transformations with medications alone. Why is this? Well, interestingly, diffuse thinners tend to have milder miniaturization that is widespread across the scalp compared to, say, a man with more localized hairline recession, where the miniaturization is more severe in specific areas. So because the miniaturization is milder and more widespread, the generally accepted 50% miniaturization rule applies here. This rule says that as long as a follicle is not miniaturized by more than 50%, we can yank it out of the grave and bring it back to life. We can actually restore it. And the good thing is that the hair follicles in diffuse thinners are often not miniaturized by more than 50%. And so a lot of them can be regenerated. So what is the perfect protocol? Well, obviously it depends from patient to patient, but starting with something like a 5-alpha reductase blocker like finasteride, again, just like regular male pattern baldness, will put the brakes on continued loss. I have seen a surprising improvement of hair density with diffuse thinners from just the standard 1 milligram per day of finasteride. In my opinion, they tend to get better regrowth. For the patient that walks into our clinic, we'll start off with the finasteride for 12 months. We'll get the patient back for a reassessment under trichoscopy. We'll look at the follicles under the trichoscope and see, okay, do they look healthier? Do they look more coarse? Have they been repigmented? The thing with male pattern baldness is the follicles not only get smaller and they shrink, but they actually lose their pigment because of melanocyte degradation. We are looking for more color in the hair follicles after that 12 months as well. If there isn't much regrowth, then we might consider a once weekly dutasteride dose. From a stimulation therapy point of view, we almost always recommend oral minoxidil in the diffuse thinning patients. The reason for that is because the oral minoxidil goes into the bloodstream and will target all of the hair follicles. And that's what we want because all of the hair follicles are miniaturizing in diffuse thinning patients. We found that diffuse thinning patients find it difficult to apply topical minoxidil over such large areas of scalp because such a large volume of topical minoxidil is needed. And if you're applying that much topical minoxidil to the skin anyway, there's going to be so much systemic absorption of that topical minoxidil, you might as well take oral. Can diffuse thinners get a hair transplant? Well, the answer is yes and no. Yes, if they have lost enough hair where the scalp can be seen even in low light, for example here. But no, if the patient still has a good amount of hair, such as in this patient here. The reason why we wouldn't operate on a patient like this is because the hair transplant process itself can damage native hairs. And I do not agree with doing this. Some surgeons out there will happily transplant into diffuse thinning patients with this much hair. The question I would ask these surgeons is, what is the point in transplanting an area where you kill lots of the native hair follicles, which could result in the same density, the same result before and after the hair transplant? Hope that helped, guys. See you in the next video.